Bismillahirrahmanirrahim. In this video we will talk about calcaneum. What is calcaneum? Calcaneum is the largest tarsal bone. It is also known as the heel bone because it bears the body weight in standing position. The whole body weight is transmitted to this calcaneum tuberosity during standing posture. Its long axis is directed forward. Upwards and slightly laterally, like this. To determine side, we have to look at two simple points. Namely, there should be a shelf-like projection on the medial side of the bone, this one, while on the posterior side of the bone there should be a blunt projected area, this one. So keeping these 2 points in view, we can determine that this is a right-sided calcaneum bone. Now coming towards the general features. Calcaneum is roughly cuboid in shape, having 6 surfaces, namely anterior, posterior, dorsal or superior, lateral, medial, plantar or inferior surfaces. Now first we will discuss anterior surface. Anterior surface is bearing a concavo-convex articular surface which articulates with the concavo-convex articular surface of cuboid bone, and it takes part in forming the calcaneo-cuboid joint. This is the smallest of all the 6 surfaces of calcaneum. While the posterior surface of calcaneum, it is divided into 3 parts: the upper, middle and lower. The upper part is smooth while the lower 2 are rough. Now the lateral surface. The lateral surface is rough and almost flat. In its anterior part it shows a elevation known as peroneal tubercle or peroneal trochlea. The medial surface is concave from above downwards, you can see, while the anterior superior part of this surface is showing a projection, shelf-like projection known as sestentaculum tali. The upper surface of this sestentaculum tali is taking part in forming the talocalcaneonavicular joint. I can show you like this. The head is resting on this upper surface of sestentaculum tali and is taking part in forming the talocalcanean joint. While the lower surface or the inferior surface of this projection is grooved for the tendon of flexor hallucis longus, the rest of the medial surface is concave. Now coming towards the dorsal surface. The dorsal surface is divided into 3 parts: posterior 1/3, middle 1/3 and the anterior 1/3. The posterior 1/3 is rough as shown, while the middle 1/3 is showing an oval, convex, oblique articular facet which articulates with the inferior articular facet on the inferior surface of body of talus and takes part in forming the subtalar joint or talocalcanean joint. Like I can show you, this is talus and like this. This is the subtalar joint which is providing inversion and eversion to the foot like this. Now coming back to the anterior 1/3. The anterior 1/3 is divided into 2 parts: anteromedial and posterior-lateral part. The anteromedial part is articular while the posterior-lateral part is non-articular. The articular part, which is anteromedial part, articulates with the anterolateral and posterior facets on the inferior side of head of talus and takes part in forming the talocalcaneonavicular joint. You can see, you can put it here. The head is resting on this sestentaculum tali and forms the talocalcaneonavicular joint, which is completed by navicular bone which is attached here to the head of the talus. Now coming towards the plantar surface. Plantar surface is bearing 3 tubercles. First one is the anterior, which is located on the anterior side of the plantar surface, and 2 are located posteriorly, medial and lateral, which are parts of the calcanean tuberosity. This is the calcanean tuberosity which support body weight during standing posture. So these are all about the general features of calcaneum. Now proceeding towards the attachments. First of all, on the posterior side, the middle 1/3 of the posterior surface of calcaneum receives 2 tendons, plantaris and tendocalcaneus. Tendocalcaneus is formed by the union of soleus and gastrocnemius tendons. Both are inserted on the posterior surface of calcaneum in its middle 1/3. Now on the dorsal surface. The dorsal surface provides attachment to 5 structures only in its posterior lateral part of anterior 1/3 on here. Namely, extensor digitorum brevis, stem of extensor inferior extensor retinaculum, stem of bifurcate ligament. The 4th one is cervical ligament and the 5th is introitious talocalcanean ligament. On the dorsal surface we can also see a grooved part, this one, which is known as sulcus calcaneum, which is lying opposite to the sulcus stelli of talus and takes part in forming the sinus tarsi. If I can show you like this, the channel formed between these two bones is sinus tarsi, which is formed by the union of sulcus stelli and sulcus calcaneum. You can see this is the channel. You can see from this side as well. This is the channel between these two bones. Now the 5 attachments are on this dorsal surface. Now on the lateral surface. The peroneal tubercle receives a slip of inferior peroneal retinaculum. There is a groove superior to this tubercle for the peroneus brevis and inferior to this tubercle for peroneus longus. The calcaneofibular ligament is attached posterior to this peroneal tubercle, while superior to the lateral tubercle on plantar surface. Here there is the attachment of lateral head or origin of lateral head of flexor digitorum accessorius. So these are 5 attachments on 3 attachments on lateral surface. On the medial side is concave. The groove is occupied by flexor hallucis longus. The attachments are mainly on this sustentaculum tali on its medial surface. From before backwards we can name them as follows. Anteriorly there is attachment of spring ligament. In middle part there is attachment of tibialis posterior, and on the posterior part there is attachment of medial talocalcanean ligament. And on the whole extent of this medial strip of sustentaculum tali there is the attachment of superficial fibers of deltoid ligament. And the medial surface below this grooved part is providing attachment to the medial head of flexor digitorum accessorius. So the flexor digitorum accessorius arises from both medial and lateral surfaces of calcaneum. Now the attachments on the plantar surface. The plantar surface, first of all, on the medial tubercle. Medial tubercle provides attachment to 4 structures: abductor hallucis, flexor retinaculum, plantar aponeurosis, and to the flexor digitorum brevis. But these are 4 attachments on medial tubercle on plantar surface of calcaneum. Lateral tubercle, this one, provides origin to the abductor digiti minimi. The anterior tubercle provides attachment to short plantar ligament, while the triangular area between these 3 tubercles provides attachment to the long plantar ligament. So these are all of the attachments and general features of calcaneum. Thanks for your time. Remember me in your prayers.